Yeah, here we go, y'all. Here we go. Another segment of Diverse Talking Heads podcast. I'm your host, Calvin Gibbs, and tonight we have a very interesting topic. Here with me is our pool pit of experts. We have Charlie. Good evening, Charlie.
Calvin, thanks for having me.
And we have Karen.
Hey, thanks for having me. Hello, everybody.
And we have Amy. Good evening, Amy.
Good evening, everyone. Great to be here.
Great to have you. So we are going to get right to it, y'all. In this country, it's been estimated that 1 out of 5 people suffer from some sort of mental illness. It could be stress, it could be mood disorders, anxiety disorder, personalities, or psychological, such as schizophrenia. But 1 out of 5 is a big number. And I remember maybe a year before the pandemic started in 2020, going to my personal physician, and she asked me if I was depressed. How was I feeling? And I was like, you never asked me that before. And she said, yeah, this is something that's going around. A lot of people are depressed, and they have to inquire if there's any need to be alerted about a patient's well-being. So that, for me, that was like the beginning of being noticeable to depression. So I'm going to ask you guys, have you ever been asked about being depressed recently? I see
Yes.
I see one hand, Karen.
Yes, I
Ollie?
have been. That is a question that is asked every time I go to the doctor.
Mm,
And they put notes down. They note what you might be revealing, suffering, how you're feeling. And uh it's interesting because when they ask the question, sometimes it's as if they're not believing you that you're not depressed.
right,
You know, life
exactly.
life is what it is. We're going to have good days, we're going to have bad days. And if you're and I've it you just answer the question.
Yeah, that was pretty much the way it was with me and my doctor. She, stared at me for a while after I gave her the answer. So I finally, tried to joke it off and say, well, I wasn't too happy pulling that copay out of my pocket. And she just continued to, stare down at me, which made me very uncomfortable. So we moved on. Charlie, I know you're a happy-go-lucky guy. Has anybody ever asked you about being depressed?
Oh, I can't say for sure, but I'm pretty sure they did. When I go to my doctor and they ask you a litany of questions, I think that it's been included. I just say no on it. I will admit to you that a very long time ago, I did see a psychiatrist for a short period of time when I was in my early 20s and all that. I'm sure we'll talk more about age groups and things on that as well. On that, but I have not done that since then. So I have personally no problem with that. They ask me, it's just another thing. They ask you, you have this problem. It could be, you have a physical problem or whatever it may be. It's just a question they're asking me, and I respond, with the appropriate answer on it. So I don't have a problem with it.
Okay. Well, I did a little digging as far as research for this topic, and I found that of all demographics, Black men is more unlikely to seek help for a mental problem. And, I got to agree with that. I am just the right amount of crazy. And it took me a long time to get to this point. I don't want anybody messing with that. I am balanced. I see Amy smiling, but, seriously.
I don't know.
Yeah, you don't know, huh? Well, trust me, Charlie, I know. This is the best version right here. We don't want to mess with this, you know. But on a serious side, has anybody had any personal connections with anyone going through a bad time as far as being depressed or any kind of anxiety? I see Amy's hands; she's waving.
Yep. Yeah. No, I'm very open about it. I do regularly see a therapist, not specifically for depression, but for a couple diagnosed anxiety disorders. One of the best things I ever did for myself ever, and it was a heck of a thing to do, is to kind of get a full mental health evaluation. And they're hard to get. Like, they are hard to like find out if your insurance covers it. There seem to be a lot more resources for children than for adults in some cases, which is great. I love the evaluation of young people, but if you're an adult saying, and you haven't like done something to preclude getting it, right? Like I wasn't being forgetful or anything. It was just something I wanted to do for my own health. But one of the absolute best things that I did was get that done, and learned so much, and really gave me the kind of confidence to find help, find a doctor. Like if I had diabetes, I would find a doctor for that. This was kind of that same, oh, now that I understand that this isn't that, there's tools that can make life better for me. Yeah, so I've been going to therapy for about a year. I do know other people that go, and I don't want to share anyone else's story because that's kind of their own personal.
Sure.
But yeah, but there's a lot, and I'll stop talking in just a second and share the floor. But it's very interesting, because I'm sure that throughout our lives, all of us have had medical professionals, whether it be doctor, eye doctor, dentist, someone where there's some where you're like, I love this doctor. You're like, but that dentist, I hate going to see it, like that there's some that you click with and some that you don't click with.
Mm-hmm.
When it's mental health, it is so important to feel like they're listening to you, to kind of respect the feedback that they give, because if it's someone where you don't feel like they're listening, like you both just gave very wonderful examples of, like, I felt like they weren't listening to me, and it was a doctor, not necessarily a therapist, it was a medical doctor. But imagine having your therapist where you say, XYZ, or I'm struggling with this, and then feeling like they're not giving you helpful feedback. It almost makes you want to give up, right? Like, well, never mind. Therapy isn't for me, and I just want to encourage, if anybody is listening to this and hears that, I do think it's really worth finding that therapist or psychiatrist, or, whatever your particular need is that works for you, because their job is to help you make your life better. And it's just been, I'll say it again, like one of the best things I have ever done.
Now, a follow-up question, Amy. You said that it was hard to find a professional to help. You would think that if this is such a big community issue in this country, or probably around the world, why was it hard?
There's a lot of factors that go into it. Not all insurance covers it, unfortunately. So the cost can be prohibitive for some. I am not in that boat, I want to be clear, but many people are. If you have, in particular, if you're on some form of assistance like Medicaid or Medicare or something like that, the coverage is much less. Based on the area where you are, like, you might personally feel comfortable with a therapist who has a similar background to you, or if you have particular religious beliefs, somebody who is familiar with those. And it can be hard to kind of find people that sort of have the again, kind of that mutual respect and background that you're looking for. And then, Calvin, as you pointed out, it is a huge crisis. There's only so many therapists. Like, imagine if 1 in 5 people had, I'll say diabetes again, or had something, had a curable kind of cancer. Well, the doctors that specialize in that would be slammed. And that's what's going on in that particular specialty right now. Is you've got so many people with so many different needs, and there just isn't enough to go around.
So, and this is for all three of you. So, when is a good time to reach out for mental health? When should you be? What's what's the trigger in a person that would make them go search for help? Karen?
I think I know someone, one of the triggers was just feeling hopeless and helpless, and not being able to see past certain traumas that had occurred in this person's life. And no matter how other people spoke encouraging words to this person, it was as if the words were soothing at the time. But once we disconnected from that person went back into that place, that dark place. And when the person went to seek help, would you believe there were no therapists available through her insurance?
I would believe it.
And this
Yep.
person was suicidal. And we got together and we were like, we don't care what you do. We got to move in with you and walk you through your day every day. That's what we're going to do because you are important. And we were shocked when the person said that they could not find a therapist. Like they were so backed up that it was incredible. And you say, okay, well, you encourage people to seek therapy, but how, when they need help, how do you open the door so that that person who might be suicidal or have a thing where they want to harm someone else besides themselves, how do you help them quickly without them causing any harm to anyone else? And we haven't thought about that. We haven't thought about mental health in a very long time, since the Ronald Reagan era, because he was the one. See, we had lots of institutions, and if you all notice in your cities, you don't have mental hospitals like you used to have, because he said that the people who were in care could do it as outpatients, and because they were functioning well in the institution. But once they left the institution and their routines changed, they became homeless. Like, a lot of people didn't want them to live with them. They were unemployed because of their mental issues and their mental stability in a work environment. So it created a whole lot. So that's why I think one of the reasons we have so many people on the streets today is because when they were housed, they were given their medications regularly, which helped them function daily. And without those medications, they were unable to function like a normal person. It's mandatory that they take the medicines. And I'm saying this as a witness, because my mother worked in a mental institution, and I saw the change from when it was time to take the medicine to after taking the medication. Mm-hmm.
Growing up in New York City, there was a big hospital there, Bellevue Hospital, that was a mental health hospital, for lack of a better word. And I remember as a child growing up, always hearing my parents and the adults around me talk about, if you take a crazy person to Bellevue on a Sunday, they will pay you, or something similar to that. And there was always a threat of taking one of the kids. I'm gonna take you to Bellevue. Just keep this up, and Sunday's gonna get here. We're going to the mental place. And although we joke about it these days, this is actually nothing to joke about, because if you're having a prolonged feeling of sadness, if you lose interest in social activities, they even say changes in sleeping or eating patterns, increased drug or alcohol use, if you're having any kind of auditory or visual hallucinations, or thoughts of self-harm or suicide, then you need to get help right away, or even paranoia. Now, I know we just went through uh, the pandemic,
Mhm.
and I can really understand that a lot of us, I'm just going to say in this country, we're going through a lot of stress, trauma, anxiety, heightened levels of depression, just dealing with, just think about what was going to happen that day and the next. I remember walking through Walmart and just losing it, man, because the shelves was empty. People were walking around like Walking Dead in there, and I couldn't take it. I just started sweating, and I had to leave my wife in there. I ran out, and it took me um, several tries going there by myself early in the morning when they first opened up, and then getting out as quickly as grabbing what I needed to get and getting the hell out of there as quickly as I could before I started feeling more comfortable again being around people. And I don't know whether that would have qualified me for some mental health examination, but I definitely feel that something was probably needed during that time period. So, with that being said, the president did sign some kind of bill about mental health, didn't he? In 2021, the was that the American Rescue Plan,
Mhm.
where they invested 5.5 billion nationwide to strengthen mental health and substance abuse care. I believe that he did sign that in 2021, but obviously we need more because a lot of I feel a lot of these mass murders that's going on is a result of some kind of mental breakdown. Thoughts on that, Charlie?
Well, I'm doing some research in the show. The groups I saw that had the greatest need for mental health services were people of color, as you mentioned earlier, and young people in
Mm,
general on that. I have a couple of people on social media who are mental health professionals, and they talk about this constantly. They work with a hospital or whatever they do on this. And this is a big problem right now, and that's why funding for mental health is very important right now, and it needs to be increased. I wanted to just add one other more thing. This is kind of off what Karen said here, which went back to the 80s here. Back in the 80s, I had a very close relationship with a dear friend of mine. I met her at a job, and we hit it off right away, and I wanted to hang out with her. And I found out she was staying, we'll just call it, I don't know what the term would be, but I'll call it a halfway house. Actually, what it was is that she suffered from schizophrenia, and she lived in what was a substance abuse place for alcohol and drug abuse issues. And that she was the only one that in that house, the place, for the most part, who had that particular issue. Everybody else had a substance abuse issue because they didn't have anywhere to put her. We met in college and everything like that. She was attending the school there, and we had a very close relationship for a couple of years or so. And I would have to go visit her. I had to call up ahead of time, like the front desk or the payphone. Hey, let's go hang out. Let's go watch a movie or have dinner or whatever. And we did that for a while. And during that time, she was taking medication, but she had her good days and she had her bad days. Some days I call her and said, I can't do it today, or she's not available today. They would tell me. So, long story short, we kind of went our separate ways. 30 years later, I tracked her down. I found her. And she lives in another part of the country. And after we went our separate ways, she did get married. She has 3 children. I met one of them. The children are all wonderful children. They're doing, all 3 of them are doing well. She's been a wonderful mother. And, she told me, when I had to admit to her, when I heard that, I was shocked by it. And I said, I underestimated you. And she said, you know what? I'm shocked by it too. I never thought I would have 3 beautiful children like I have. And she loves her children very much. There's no question about that. And she continues to take medication. And she has, for periods of her adulthood, she's worked in the field that she majored in college. So she's worked professionally and all that. And, which shows, you can work your way back. You can work your way back. She worked her way back on it. And it's not easy and all that, but she apparently had the support system to do that. And I've actually seen her in person. I hope to see her again this year. She lives in another part of the country. So I like to think that there are difficult mental health issues, but some of them can be solved and people can go back and live a normal life.
They are solved, Charlie. And here's the thing, they're solved when they take their medication. When they are consistent with their daily medication, they'll function just like you and I. It's when they don't take that medication is when they have the I forgot the term, but it's when they have the issues. Because a lot of the people, even though they were staying at the hospital that my mother worked at, they had jobs. They worked in different places, and they would take them to work and bring them back home, where they had like an assistant, an aide that would go with them, and most of them worked the same place, be it a factory around the corner or whatever in the Bronx. So, I've seen that side, but not taking the medication is the issue.
Mhm.
That's when they have,
That's a lot of it, I think. Yeah.
it is. But then you have to ask this question too. Are the medical cocktails that the doctors are prescribing sufficient to help that person maintain their sanity? Because it can have an adverse reaction. It might be too strong, not strong enough, or the drugs combined together might not be a good cocktail. So many things you could say. Ask. I'm sorry. Yes.
Yeah,
So
so
fun.
what I'm so
Fun.
so what I'm hearing is once you get the right cocktail that works for you,
Mm-hmm.
is this usually a lifelong thing of taking this?
Eternally. Without it, you can't survive. There's no such thing as going off your meds. There's no such thing. And it was the head of Bronx Psychiatric Center, Dr. Butts. We had a discussion because I wanted to be a psychiatrist, and he gave me a whole bunch of literature, say, hey, read up on it. And once your brain cells die, they don't rejuvenate. I mean, regenerate. So you have regenerate. So therefore, you're always going to be missing that piece that kept you whole. You're always going to miss that. And it has to be. But within the last, say, 10 years, we've been more proactive with mental health because a few Congress people had some issues. And, Congress had been defunding hospitals, defunding mental institutions. That's why they're scarce now. A lot of them are closed, gone. They don't have the patient population that they used to have because Congress said they can do outpatient care. No, they can't. Some people need in-house medication, housing, and therapy.
Or the general perception, I think, in our country, pull yourself up, get yourself together, independent spirit. And I think there's a lot of institutions that feed into that. I think a lot of our movies, like the story of it is, I overcame this adversity, or I met the right person and now life is good, or I just had to have more faith in whatever and now everything's better. And that is not correct for everyone. And I think that builds in a level of shame of someone feeling like, why do I have to be dependent on this medicine? What's wrong with me? I feel better now, I'll stop taking it. Or it could be cost prohibitive, or, I don't have any right to complain, so that person's life is so much worse than mine. I don't have any place to think that I need mental health or think that I need support. Like, I think there's a lot of factors that feed into it. And I think, Karen, you have a really good point. And I feel like no one should feel ashamed of trying to take charge of their health, whatever it is, even if you feel a little timid or a little silly, like I hope I would never contribute to making somebody feel that way, because you are important. And Karen, I'm so impressed that you and your friends cared for your friend that way and took them seriously and weren't like, no, you're not, you're fine. That you really gave them what they needed and were responsive. And if we all kind of approached somebody saying like, oh, I'm struggling, or oh, I'm feeling tired today, I don't know what's wrong with me, with that level of care, it sounds simplistic, but I think the world would be a better place. Like, don't laugh it off, don't brush it off, don't be like, oh, what's wrong with them, why are they complaining? Like, they have a reason, and we should just respond respectfully.
Well,
Thank you, Amy. You said a lot, and it's true, because it took someone else to realize the depth of this person's depression. Because when someone is like, yeah, I'm okay, I'm good, to one person, but then they talk to another person, and that other person is hearing something else.
Mm-hmm.
That was why, and every day, no matter what the time, we hit her up. Are you okay? Did you make the appointment? And we stayed on her. Like,
Mm-hmm.
we
Mm-hmm.
stayed on this. I didn't mean to say her. We stayed on this person, and we were like a wound that wouldn't heal, because we wanted her to be all right. She was a successful young person, and I just didn't think that it would. I've never experienced that with anyone that I had known. And I have experienced people who were depressed, suicidal, so forth and so on, but not like this, not at a young age, because I think that what we've done in America, we've convinced people that we are always going to have good and no bad. And life doesn't work like that. There's good, bad, all kinds of things are going to happen to you, but you have to recover from. You have to will yourself to recover from it. And if you can't, seek help. Seek help.
Mm-hmm.
It's okay to seek help. And if anyone makes fun of you, that's not a person you want in your life. Let them go. Cut them
I
off.
think, just to piggyback off of that, sorry, but just because I think sometimes people do think like there's a couple different mental health hotlines. Like, there's one where you can text, there's one where you can call. Some communities even have their own. There's like the federal, the national ones. And I think people think that I should do that like when I'm ready to take drastic action. And before then, I should not do that. And I don't think that's accurate. Like, I think that, or there's even like online, like better up or something like that, I think is one of them. Like, there's actually a lot of resources, and I'm not endorsing all of these and saying these are all the best and they're all going to be a fit, because there's a lot that goes into them. But I think it is completely okay to say, I am feeling stressed right now and would like to talk to someone. Done. You don't have to like have a plan. You don't have to have drastic action. You don't have to even say what is stressing you. But I feel like I could say that to any of you and you would respond. And I would hopefully do the same for you. I am feeling stressed right now. I would like to talk to someone. Okay, talk. You're a valuable person. It's more important to me that you said that than you sat there feeling stressed and beat yourself up about it. So, and then, but just my point was, you don't have to feel like you were at the end of your rope. You should actually reach out well before that, in my opinion.
I recently had the chance to talk to a couple of youth groups, and the topic they wanted me to bring to the youth was that at the end of the day, you are enough, that you've done the best that you could, you love and you like yourself, you're allowed to make mistakes, things like that. And the programs went very well, although I feel it was just scratching the surface, and I was not qualified enough to go deeper into it. A true story, in the late 1980s, somehow, I forget how I got this job, but I had a job working on the New York City suicide hotline on Friday nights through Friday evenings through Saturday mornings. And I did it for 3 weeks and couldn't go back for the fourth week. the things that I heard, and I had no formal training. I had a big manual that I would flip through with phrases they wanted me to say. And this one young man got on. He was gay. He was going through some stuff, and he was threatening to kill himself. And in the middle of trying to talk him down, he hung up the phone. And I never found out what happened to him. And that was the end of the shift on that third week. I just could not go back again. So the mental health field, as far as careers, seems to be a lucrative area to go into. If they don't have enough professionals, they need more, and they're gonna have to pay them, because with 1 out of 5 people having some kind of um, situation with that, that's a lot of money for big pharma, and a lot of money for the people to help treat that as well. The National Suicide Prevention Hotline is 988. And I hear that's a very good number you can call. It's 24/7. You can call and get a professional on the line to help you talk through whatever situation you're going through. I'm going to ask the panelists for any last thoughts on this topic that you might want to share with the listeners.
Check your county website, your local government website. They probably have local mental health resources as well. Like, for example, the county I live in, we actually have an app that it works kind of similar to that hotline, but there is also a text line there, and there's a list of all of the providers. I'm not going to say every local government has it, but I would recommend that folks check, because you might find something closer to home and easier for you to access, in addition to that great hotline that you shared. So that's my final thought on that topic.
Thank you.
Great thought, Amy. I work for an organization. I work for the Department of Human Services, and they do have those services, adult services, mental health services, and sometimes they're based on a sliding scale financially. If because a lot of people who they found out had money was coming to get services and thought they were going to be free. But talk to your doctor. Be honest with your physician. One of the things that you have to do is, when you go into your doctor's office, be honest and open about everything that's going on with you, because you have no idea what information or resources they're going to recommend to you. And if you need a therapist, most doctors, primary care physicians, know therapists to recommend you to. And like Amy said, check your local county government website. Whatever they have the services, and use them. Don't be embarrassed, don't be ashamed. Everybody needs help at some point in time.
And thank you, Karen. And I would add to that, Charlie hit upon that earlier, is that age. There's elders all around us. Talk to them, see where they're at. Inquire, ask questions, and really watch what they're doing and how they're acting. You may be able to help them in ways they don't even understand right now. Charlie?
I agree with what you have said, Karen has said, Amy has said. Go on the internet, Google it, mental health services, your county, your city, your state, whatever. And I will say this, I happen to be going to the doctor's office tomorrow for a minor issue, but if I had a mental health issue, I would certainly bring it up with my physician.
All right.
All right.
If you're a student services, I forgot to say that. If anyone listening to this is any kind of student center, I'm sure they have something. Absolutely. Yeah, high school, college, I'm sure they have something. Okay, I'm done.
All right. Well, that's it for this part of the show. We're going to take a short break, and when we come back, we will have our round table discussion which will be led by one of the panelists today, only on Diverse Talking Heads podcast. And we are back. This is Diverse Talking Heads podcast. I'm your host, Calvin Gibbs, and now we are going to move into our roundtable discussion. This is a topic that we're going to speak about that only one of us know what the topic is, and that's our panelist, Amy. Amy, take it away.
All right, I have a heavy one for you this week. So my last one was astrology, a little bit lighter. This one is not it's not like that. It's a totally different. All right. So I'm gonna kind of build up to it. So I think all of us since 9/11 have heard the phrase many, many times. If you see something, say something, right? We've kind of got it conditioned into us. Like if you see something, and it could be, somebody walked away from a grocery bag on the train, but you got to go say something. Safety, safety, safety. It's related to that because I think that we have all gotten to be a lot more conscious about public safety. But there's realms of personal safety where I feel like, and not just you personally, but you observing other people, where I feel like there's more that we could do, but I don't quite know where that line is. And specifically what I am thinking about, I told you, I'm kind of easing us into it because it's a little bit heavy. As a foster parent, and there might be other folks on here as well, like Charlie is a CASA, there's a thing called mandated reporter. Perhaps, Karen, you're familiar with it, you're nodding your head, where if you believe particularly a minor is in a dangerous situation, you are mandated to report that situation to the proper authorities. And since I learned about this and became one, I can't imagine what life is like for teachers or pediatricians, because whoa, it's this whole other world. But there's the concept of when are you helping versus when do you need to mind your own business? So I am curious if anyone has been in this situation or has stories or has heard of stories where there was a youth and you saw something or you observed something or you heard something. And what is that struggle of I said something versus I was like, not my family, not my business, not my people, right? Heavy topic. Everyone is sitting back and thinking. If you want me to keep talking, I will, but I would love someone else to, because I definitely have situations where I'm like, I don't know. I don't know. I don't want to make it worse, but I'm seeing what I'm seeing.
Well,
I'll pause.
I will jump in because two of them come to mind. And one is the way parents treat their kids. There's some places where discipline needs to be applied at times, but I don't believe in abusing your kids, especially in public. And if I see that, I'm probably going to say something. My wife is definitely going to say something. And then if you say something to her, then it's like all in. Let's get them. Another situation is seeing a man hit a woman in public. Yeah, yeah, that's a big no-no. I've been in fights defending someone. I don't even know who the lady is, but I know that she got punched in the face, and that didn't sit well because men don't hit on women where I come from. That's it. So, yeah, there are some situations where if you see something, you need to say something.
Totally agree. Thank you for stepping in like that, because that
Oh,
is, yeah, clearly over the
Calvin,
line.
Calvin. Did you hit a nail? The hammer to the nail is what they say. I have witnessed a couple of friends being physically assaulted in my presence. And my reaction was not expected by the man, but he realized you can't do whatever you do behind closed doors, that's between you and her, but you're not going to do it in front of me. I have gone fisticuffs with a guy for punching a woman. And the only reason it turned out that way for me was because he got up in my face as if I was going to be fearful. But what he didn't know was I had two brothers who he should have called and said, just don't say anything to her, period. Because it's like, and I'm not saying like, oh, it's a, it's a badge of honor, but I used to be bullied as a child because I didn't say much to people. And people would always say stuff to me. And one day you just get sick and tired because it was tearing me down mentally. But I have also called social services on parents, because I didn't like what they were doing to their children who had love for them unconditionally, not knowing how they were going to be damaged as they grew older.
Yes. Yep.
And it doesn't make a difference whether they're a smoker, drinker, addict, whatever. Their kids love them regardless. But some people talk to kids like they're talking to another adult, and that baby doesn't deserve it. And like Calvin said, discipline, you don't have to spank a kid. You don't have to put your hands on a kid. Take things away, timeouts, whatever. Be firm in what you say. But yes, Amy, yes.
No, thank you for doing that. And it is hard because the kid is not going to come to you and say, please call on my behalf, because they're like, oh no, it's my fault. I did something wrong. I love my parents. That you must have, it takes such strength.
It was hard
to do
that. It was very hard. It was very hard. And it's just one day I just had enough, because this parent was so ungrateful for the blessing that they received, which was the children, that, you don't, somebody, and sometimes there's nobody to rescue the kids and the family, which is even sadder. So thank you.
Yeah, but sometimes they can't push your button, but you got to know how to handle that.
Well, I'll speak here. My first thought is I'm in a tough crowd here. But that being said, as Amy mentioned, I am a volunteer for the CASA organization with foster children. I have luckily, I've not had an incident where, and yes, I am a mandated reporter, where I've needed to do that. There have been some factors within the case that are, that I even learned after the fact, or were not central to what was going on, that were certainly questionable. But I have not had an incident where I had to do that. My spouse is also a mandated reporter because she works in a school, so she would do that as well. One of the things I'll mention on the TOS is if I see an event on there, the first person I contact is my supervisor about it. And my supervisor is a child and family lawyer as well. So I make sure that whatever the incident is would fall under that, and then we would do whatever is appropriate on it.
Good. Yeah, it's great that you have that someone else to bounce.
There's a buffer there. There's kind of a buffer in case you're not 100% sure. Am I doing the right thing or not? I do have that. And my wife does as well, obviously in their school and all that with other educators and that.
I was at an event recently where there was actually a police officer speaking who works particularly with youth in danger. And she brought up a very good point. It was a female officer. And she said, our job is to figure out if intervention is warranted. That's not your job. So if you think it's warranted, turn it over to us and we'll tease it out. And that was oddly reassuring. I'd love them to say like, no, there's never any bad things that happen ever. But as we just talked about, that's not the case. But to kind of alleviate some of that responsibility, because you're like, what if I'm wrong? Well, they'll figure it out. You were trying to help somebody.
Exactly.
And the other thing you mentioned, 9/11, for the last 20 some years, whenever I do have to fly, I know that I'm personally watching everybody. Anybody that gets up is getting eyeballed. And I've had this conversation with my wife, and we've decided that we're not going to be held hostage. So if anything jumps off, jumping in. That's it. And let the chips fall where they may. But outside of that confined environment, yeah, I do watch people more these days. If I see something, I definitely will try to get law enforcement or someone involved that can handle the situation. The last thing I want to see is someone with a long gun, and there's nobody around to help. And as what happened in California, that Asian guy had to jump in and take care of it. It's kind of the world we live in. Sometimes you have to do what you need to do. So
have the professionals deal with it if you can.
But it's interesting. I just flew last week, and not only since 9/11, not when 9/11 kicked in, we had all these rules and regulations that were implemented. No water bottles, no more than 4 ounces, whatever. Was it 4 ounces of water, whatever. But yet, we hear these statistics about people going through security with guns, knives. What do we do in America? There's some airports where you got to get close to naked. Some just go on through, pull your laptop out, different things. And it's like, okay, what are we doing? Why can't our security be universal from East Coast, West Coast, North and South? Everybody have the same criteria. No shoes, no socks. I mean, there was a time when you had to take your socks off. And even the what is it? The body scanners, the triangle scan. Even those are inaccurate. They do. Every time I go through one, it always picks out a spot as if I have contraband, and there's no way possible. I have a T-shirt on, no pockets. Where's the contraband?
No valid point.
We have to do better. And TSA. I understand that you can't engage people in conversations, but you could have better customer service because each airport is different. And like I said, some people you take your shoes off, some you don't. If someone's asking you a question, it's a yes or no question. It's not a roll your eyes and grumble. Asking somebody. I was like, what in the world? Incredible. But 9/11 scared me. And I pay attention to everything, especially when I'm on a plane, who I'm sitting next to. And they don't even realize that I'll ask them their name just in case it's an emergency. Ask them their name. You don't know.
All right. Well, thank you. Yep. Thanks for your thoughts. Like I said, it was a heavy topic. So I appreciate it. And after that mental health conversation, I felt kind of bad putting that on us, but I truly wanted to hear your thoughts on the topic because it is something, I think it's a struggle. And I just appreciate everybody weighing in and the good work that you do. I thought this audience, everyone would have a story of getting involved, and most of you had several. So that's it, Calvin. Back to you.
Thank you, Amy. Thank you so much. Well, that's about all, y'all, for this segment of Diverse Talking Heads podcast. Again, I'm your host, Calvin. I want to thank our panelists. I want to thank Charles, Amy, and Karen. And it's always important that we take 2 steps to the rear and get on out of here. Until the next episode of Diverse Talking Heads podcast, We're going to exit. Stage left.